All right, everyone, welcome back to the office. My name is Dr. Perez. I have our volunteer patient Sandra in the office today, and I will be demonstrating the basics of the cranial nerve exam. Okay, so we are going to be going over the essentials, testing basic cerebral function, making sure that Sandra does not have any particular deficits happening, mostly pertaining to neurological function, eyes, ears, nose, sense of smell, sense of taste, and sense of touch. Okay, now I know you guys have been studying this for the last few weeks, as this is what we've been going over in our course, and this is what you will be tested on next week. So I want everyone to pay attention, make sure you're taking notes. We've already obtained consent with Sandra. I have cleansed my hands, and we have quite a bit to go over, so I am going to go ahead and get started. Okay, all right. Sandra, is it okay if we go ahead and proceed with today's examination? Yes. Okay, all right, thank you. So to begin the examination, I am going to go ahead and put on a pair of gloves. As I stated, I have already cleansed my hands. Now please remember that, as always with every examination, you need to be either using soap and water or hand sanitizer prior to donning your gloves. That is part of standard precautions. Now I do apologize, my gloves today are just a little large for my hands, but that's okay. So we're going to start as usual with our basic visual inspection. Now this is something I do regardless of the examination. So I'm going to grab my Penlight and we're going to have a look at Sandra to start with. So what we'd like to look at for every exam, whether it's a CNE or otherwise, is just kind of basic posture, do a bit of an assessment of the patient's face, make sure there's no drooping of one side or the other. We like to look particularly at the forehead and brow region. So as you can see, Sandra has very nice eyebrows and they are symmetrical. There's no sign of drooping at the eyelid there. And coming down toward the mandibular region, I also don't see any atrophy of the musculature in the lower half of the face. All of that looks pretty symmetrical and even, I would say. And as we come down towards the scapular region and have a look at her shoulders as well, I do see not what I would consider misalignment, but Sandra does seem to have one shoulder that is slightly higher than the other, which is probably just due to a need for postural correction. And coming down towards the chest wall, we want to have a brief look at the clavicle bilaterally here to make sure there's no signs of asymmetry, which is not present. I also don't see any protrusion directly along the breastbone. And then looking at Sandra's arms, if I can just have you place your hands flat on your lap for me. We're just going to look over at the arms. I like to look at the elbow line for symmetry across the breastbone, which is present. And then Sandra, if I can just have you uncross your feet for just a moment here. Just looking at knee symmetry as well, which is present. So you can go ahead and sit whichever way is comfortable for you now, Sandra. So beginning with our visual inspection with Penlight, I am going to go ahead and have a brief look at Sandra's skin and just kind of overall health and wellness of the upper extremity, upper face. So Sandra, I'm going to have you just kind of look around the room. You don't have to look directly at my light. It is fairly bright, and we will be doing a lighted portion of the exam, just not yet. Okay? All right, so Penlight is on and working. So I am going to have a look here at Sandra's face. Now, just coming in, and I'm going to just place my hand here if that's okay. So this is just going to kind of allow me to act as a stabilizer. I'm going to come in with my light, not shining it in her eyes just yet, just having a bit of a visual closer look here, looking at the external ear. Don't notice anything abnormal there. Some slight pinkening, but that is within normal limits of her ethnicity and skin tone. Again, looking over the brow. No signs of thinning or hair loss, not noting any alopecia of the eyelashes as well. Her lashes are very full, nice and long. And looking at the overall texture of the skin. Now you want to keep in mind the age and ethnicity of your patient. Also, the occupation can make a difference in skin health, whether or not they work outside can all make a difference, as well as if they're wearing sunscreen, that kind of thing. So all things to keep in mind. All of that does look intact here, and looking at the mouth as well, lips are very well moisturized. I find that the lips are a very good indicator of whether or not your patient is drinking adequate water. Sandra does appear to be well hydrated as far as I can tell. And again, coming down the chest wall, all of that looks okay. Sandra, I'm just going to take your arm here and having a brief look at the upper extremity. Again, skin tone is normal. Now, Sandra does have quite a few freckles and sunspots. She is fairly fair-skinned, so that is normal. And as I look at the inner arm, I can see some prominent veining here. So all of that looks okay. You just want to make sure you're not noting any signs of occlusion or anything that looks like it's protruding. Nothing that's causing her any pain as I palpate, so that looks good. And then as I just bring her arm up here, having a look at the fingers and the nails, I like to do a brief palpation here, pinch down at that capillary refill, and again, we're always looking for that 2 to 3 second return of blood flow, which is present here for Sandra. And as we look at her palm, again, we're looking for any signs of abnormal discoloration, any palmar erythema, which would look like a redness or rash of the skin, which I'm not noting on this side. I do see a small freckle there at the thumb. So go ahead and relax for me, Sandra. We're going to repeat the same on the other extremity. Excuse me. Just move your glasses here, Sandra. As I come onto this side, I'm just going to do the same thing, a brief inspection of the arm. Sandra, I'll have you raise your arm for me. I'm just going to look at the skin tone, which appears normal. Again, just lots of freckles. Hand health appears intact. And as I pinch down and test for capillary refill, I am getting a normal 2 to 3 second return there. So again, just looking for any signs of that palmar erythema or any signs of psoriasis or contact dermatitis, which is not notable in Sandra. So go ahead and relax your extremities for me. All right. So what we would proceed with next in the examination would typically be our stethoscope assessment. So I will briefly demonstrate that for you. Now, you guys should be pretty familiar with this at this point. We've done this with several examinations, so I will keep this very brief. Always make sure that your stethoscope is auscultating properly and that you have it adjusted to the correct side. So we are going to listen over Sandra's heart, okay? Sandra, I'm just going to have you breathe normally to start with. Okay, this is fairly cold, so please just keep that in mind. I'm going to start here, just below the clavicle. And we will just listen for a couple seconds. Listen for any abnormality in perfusion of the heart. That sounds good. Coming over center chest wall. Very good. Heart rate is very steady. No signs of tachycardia or bradycardia. Her heart is not beating too slow or too fast as far as I can hear. And I do hear symmetry bilaterally, which is a good sign. I'm going to have you sit up tall at the abdomen for me, Sandra. I'm going to place this just below your breast and right at the rib cage. And again, bilateral auscultation. You always want to tuck one side to the other so that you can compare for any abnormalities there, and all of that sounds okay. I'm going to come behind Sandra to proceed with the lung assessment. Sandra, I am just going to proceed with a brief lung assessment here. So I'm going to have you breathe normally for me just to start with. I'm going to place my stethoscope just here, right below the shoulder, kind of at the scapular indentation there. I'll do the same just over on the other side. Very good. I'm going to have you take a deep breath in for me, Sandra. Good. Good, and one more. Very good. Now I'm going to tap over your back. I'd like you to say 99 out loud when you feel me tap, okay?
99, 99, 99, 99, 99.
Very good. Okay, all right. All right, so Sandra's heart and lungs appear to be intact. I didn't hear any abnormalities there. Heart is well within normal range. Heart rate was within normal limits, and I didn't hear any signs of arrhythmia or anything that sounded concerning, as well as with her lung health. Okay, so we can go ahead and move on. That covers kind of the basics of vital function. Now, obviously, her actual vital signs, blood pressure, heart rate, counted, temperature as well, has all been tested prior to her examination today. So, moving on to the secondary portion of our cranial nerve exam. At this point, I am going to test Sandra's pupillary function. So again, with my Penlight, I'm going to be shining this in her eyes. And at this point, we are actually testing for constriction and dilation. So we're testing for bilateral and concentric responses. So Sandra, I'm gonna have you look straight ahead at that point on the wall there. I don't want you to look directly at the light. Okay, so this might be just slightly uncomfortable. The light is fairly bright. I am going to come just a little bit closer here. I'm gonna shine my light in both of your eyes. I'm gonna start on this side, slowly coming in from the outer corner towards the tear duct. And repeat the same on the opposite side. And with this class, I am looking for both direct and concentric response, which means I'm looking for a response in the pupil directly on the eye that I'm testing, as well as a concentric response on the opposite eye. Then we're going to perform a swinging light test in which we swing our pen light back and forth, and that does appear normal. Then we're going to have Sandra do what's called a follow the light test. So I'm going to have Sandra keep her head midline. If you have a younger patient or a patient who has trouble with focus, you can use your hand to act as an anchor. I trust Sandra to be able to keep her head steady. So Sandra, we're not going to move our head or neck, and we're just going to follow the light with eyes only. Okay? So I'm going to start midline to Sandra's nose, and we are going to move testing every direction of the visual field. We like to go in an H pattern. It just makes it so that you're hitting points both vertically and horizontally here. Looking for any signs of nystagmus or dragging, anything that looks like a fluttering of the eye or inability to follow. Are you feeling any discomfort as we come to these outer corners, Sandra?
No.
Any double vision?
No.
As I come closer, any double vision?
No.
Any blurry vision or double vision here?
No.
I'm just going to hold one eyelid up here and have a look at the sclera. Good. Okay, all of that looks okay. Give you just a second to take a break from that light. So I am going to come in with a secondary light. This one is not quite as bright, but it will allow me just to look directly in Sandra's eye. All right, so now I'm going to come closer to Sandra's face, and I'm going to visualize her optic disc as well as the optic nerve and other parts of her ocular anatomy with my ophthalmoscope. So Sandra, I apologize. I'm going to come very close to your face now. I'm just going to use my hand as an anchor here. And I'm going to come in again from the outer region, shining my light directly on the eye. I'm going to hold the eyelid down as I come in and around. And then I'm going to switch and hold the eyelid up, coming in even closer as I look directly at the ocular anatomy, and optic disc has been visualized. It is clear. Very good. Okay, give you just a break there. I'm going to come over on the other side. Okay, so same thing. I'm going to start here and just pull down at the lower lid. Okay. And I am going to switch. It's a little difficult for me as I am right-handed, but I'm going to hold up the upper eyelid. And coming in very close to Sandra's face. Optic disc is visualized. You're going to follow that. And very good. No issues there. Okay. All right. All right. Now, while I have this lighted tool out, I'm going to go ahead and switch to my otoscope. Now, Sandra, do you ever have any issues with your ears or your hearing?
No.
So no issues with abnormal earwax, no loud exposure to sounds frequently like concerts or loud trucks or anything like that. Nothing that could have possibly damaged your hearing.
No.
Okay. And is there any pain at all as I put any pressure here on the external ear? That feels okay?
That's fine.
Okay, all right. So we're gonna go in and visualize with our otoscope into Sandra's ear. Now, just be very careful that you're not inserting the tip of the otoscope too far into the ear canal, as we don't wanna damage her eardrum, okay? So what you're gonna do is pull kind of out, down, and back. So you're gonna place your hand on the patient's face, and that is also going to keep you from jabbing them as you visualize. So obviously don't yell in your patient's ear. And I'm just gonna have a look here. All right, the ear canal is actually very clean, Sandra. You have almost no earwax. And tympanic membrane is a very pearly gray. Looks great. Very, very clean ears. Coming over onto the opposite side. And again, just having a look. And this side is nearly identical. Nothing abnormal noted here. Tympanic membrane is clear, normal in color. Good, very good. So just something to note. All right, so we can go ahead and move on. Now, this part of our examination is going to consist of a test of her upper extremity reflexes. So just have a reflex hammer here, and I am going to test a couple of different things now. I like to kind of work my way down. So for Sandra, we are going to start at her face, which means testing reflexes of her eyes. Now, Sandra, what I'm gonna have you do is look just kind of lazily across the room. I'm going to be tapping around your eyes, testing your blink response. Okay, so I'm just gonna come a little closer here. I'm gonna hold at the forehead. As I tap, I want you to watch her eyelid response. We see a heavy blink there. We're also gonna test that at the outer corner, being very gentle. So we use our finger as a buffer. You're not hitting the patient with a hammer. We are just gently testing that reflex. We're gonna do the same here at the lower jaw. Good, good. And then I'm gonna have you hang your jaw just kind of loosely open for me, Sandra. So just open, good. So teeth not touching. And then we're going to tap here. And what we're testing for here is jaw strength, making sure that the jaw does not close. She did very well with that. Okay. So next I'm going to test for reflexes, of the upper extremity. So Sandra, I'm going to have you bring your arm just up here, and I want you to just kind of relax the weight of your arm in my hand. Now, you want the full weight of your patient's arm in your arm. You're gonna hold at the elbow, thumb kind of medial to that ulnar bone. Very good reflex reaction there. Good. Same thing at the wrist. Now I like to switch arms. You're gonna hold at the wrist. Sandra, just very, very lazily relax there. Very strong reaction of the hand. And then lastly, we're gonna test at that third digit. So just relax, kind of flaccid at the fingers. And just testing for any rigidity which is not present. Okay, so obviously we'll test bilaterally here. So again, just very heavy arm here, Sandra. Not as strong of a reaction, but we did get some reactivity there. Now, she is wearing a smartwatch, so I'm just going to adjust that here, and then, good. Okay, and then I'll have you turn for me. Okay, you can go ahead and relax. Sandra, are you left or right-handed?
Right-handed.
So in Sandra's case, that does make sense, as her right extremity had a stronger reaction to the reflex testing than her left side, which is fairly common, I would say. Okay. Now, of course, if this were real clinical practice, you would continue to test lower extremity reflexes at the knee, at the ankle. Babinski reflex is also a really important one there. Okay. So in place of Babinski, we are going to test for neurological response in the hands rather than in the feet. Now, this one is more so to test for reactivity of the face. So what I'm going to do is hold your hand here, Sandra. So I'll have you just kind of turn for me. And I want you to just look across the room. Don't pay any attention to what I'm doing here, okay? So as I'm stroking, as I'm stroking Sandra's palm, I want you to keep an eye on her face, and we're looking for any reactivity here. Normal neurological response would be that she can ignore this sensation and not respond to it. Good. So do the same thing on the other side. And again, Sandra is doing a very good job. Good. Okay, you can go ahead and relax. That is all well. Okay, so moving right along, we are going to test for kind of the basics of her neurological function. So what I'm going to do, Sandra, is hand you a couple objects. I'd like you to attempt to identify them for me. So I'm going to place an object in your hand. Should be a fairly identifiable everyday object. So I'm going to have you close your eyes for me. Now, class, you're going to hold the object. Make sure not to show it to the patient until you are ready for them to touch it. So eyes are closed. Place in the hand, and you can go ahead and feel around and attempt to tell me what that is.
It's a latch hook.
Good. So latch hook, carabiner, whatever you deem is appropriate. Secondary object here.
Paper clip.
That is a paper clip. Very good. And if I can have you extend the other hand for me. Can you tell me what that is there?
That's a safety pin.
Safety pin. Very good. Oops, sorry. I'm going to hand you one more object. I'd like you to identify that for me.
That's a small latch hook.
Small latch hook. Very good. So, Sandra, you can open her eyes. She answered prior to me asking, which is well and good. She went and told me that it was a smaller latch hook than the initial that I gave her, so that is very good. Okay. All right, so now we are going to test for a couple different things using these small finger covers here. So, Sandra, I'm going to show you couple different colors, and I'd like you to attempt to just identify them for me to start with, okay? So I'm going to hold something up here. Can you tell me what color that is?
Green.
Good. And here?
Blue.
Blue. So I'm going to test for her ability to follow the object similarly to what we did with the Penlight, and then I will test for her visual field and blind spot as well. So I'm going to start here, and I'd like you to just follow it just as we did with the Penlight. So just follow it around for me. Tell me if this changes colors as we go. Does it still look orange here?
Yes.
Orange here?
Yes.
Orange here?
Yes.
Very good. So I'm going to switch to the blue. So I want you to keep your eyes fixated at that point on the wall. I'm going to bring this in and out of your visual field. I don't want you to move your eyes. I'd like you to tell me when you can see it, okay? So if I start here at the center, can you see that that's blue?
Yes.
Tell me when you no longer see it.
There.
Good. And when you see it again?
Yes.
No longer see it?
Yes.
And when you see it again?
Yes.
And here?
Yes.
And now?
Yes.
Good. I have rather short arms, so I'm going to switch here.
No.
Good. Keep your eyes at the center.
No.
Good. And now?
Yes.
Good. Very good. Okay. All right. So that will test her basic neurological function and ability to identify everyday objects, as well as test for color blindness. Now, in a more in-depth examination, I would maybe test with Ishihara test plates or a Snellen chart, but for the purposes of today's examination, we are focusing strictly on the cranial nerves that are not tested within other examinations, such as an eye exam. Okay? So Sandra, I'm going to do a very brief hearing test for you here. I just want to make sure that your hearing is well and intact. You said you don't typically have any issues with your hearing. So what I'm going to do is kind of use my finger to create a buffer sound on one side, and I'm gonna make a sound on the other side. So I'm gonna have you close your eyes. I'd like you to identify when you hear this sound, okay?
Yes. Yes. Yes.
Good.
Yes. Yes. Yes.
Good. Now I'm gonna use a tuning fork. Can you hear this?
Yes.
Tell me what side you hear it on.
My right. My left.
Good. Can you tell me if this here is louder than this?
No.
Good. Can you tell me here if this is louder than this?
Yes.
Very good. And testing bilateral conduction here. If I place this at the center of your head, can you hear and feel that on both sides equally?
Yes.
Very good. Okay. All right. So hearing is intact. If there were any deficits with that, we would continue on with a bit more of an extensive examination. Okay, so Sandra, you can open your eyes very briefly. I am going to finish out your cranial nerve exam with a test of cranial nerve 5, which is the trigeminal nerve or sense of touch. So, testing with a couple different things. We are going to start with our soft. So I have kind of a soft cotton wisp here. Can you feel that that's fairly soft?
Yes.
Okay. So I'm going to have you close your eyes. I'm going to touch your face with it. I'd like you to just say yes or nod your head if you should feel it.
Yes. 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 Yes.
Good. Now, bilateral sensation, does this feel the same on both sides?
Yes.
In here,
Yes.
in here,
Yes.
in here.
Yes.
And down the arm, does that feel the same?
Yes.
Okay. So I do like to test with one object and then with two identical. I feel like it gives me a more accurate reading, specifically for the cranial nerve exam. Now, we could also test with something fairly similar. This is just kind of a lighter feather-like touch. So I will use this for our follow-up, but Sandra, I'm now going to touch you with a very kind of sponge-like object. This will act as our dull sensation. Can you feel that that's fairly dull?
Yes.
Okay, so again, just identify when you can feel it.
Yes. Yes.
Now we do want to alternate
Yes.
where we're testing
Yes.
class. You don't want to test equally left to right, as we don't want the patient to
Yes. Yes.
remember the pattern in which you're touching.
Yes.
Very good. So testing sharp sensation, Sandra, I want you to open your eyes for just a second and bring your hand out for me. I just want to give you a demonstration. You always want to make sure to demonstrate with the sharp as to not scare your patient or, injure them. So I have two identical objects here. Can you feel that that's fairly sharp?
Yes.
Doesn't hurt, but just kind of distinct?
Yes.
Okay, so go ahead and relax. I'm going to do the same thing to start with. I'd like you to just tell me if and when you feel something, okay? So close your eyes for me.
Yes.
And can you feel that it's sharp?
Yes. 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 Yes.
Good. Now, bilateral sensation response, does this feel identical on both sides?
No.
No. Which side felt different?
The left.
The left. Does it feel less sharp?
Yes.
Okay. In here?
My left.
In here.
Left.
It felt less sharp on the left each time.
Yes.
Okay, so let's retest that here with a sharper wheel. Now, can you feel that this is sharp?
Yes.
Tell me if this feels the same on both sides.
Left sharper.
Okay, in here,
Left sharper.
in here,
The same.
in here.
The same.
And if I come down the arms, does that feel the same?
Yes.
Okay, so Sandra is actually showing a deficit in the upper region of her face where one side appears to be either feeling more sensation than the other side, or the other side is showing a deficit. Now, that's not something I have time to deep dive with the examination today, but if you guys are interested, I could move forward with another teaching style examination in which I focus more on the trigeminal nerve and we kind of rule out sensory deficits there. Okay, so We are going to now test for sharp or dull response, and this will kind of further help investigate that a little bit. So now I'm going to alternate between a dull sensation, Sandra, and a sharp. Can you tell that those are different sensations?
Yes.
So just call out which one you feel.
Yes.
Does that feel dull?
Dull.
In here?
Dull.
In here?
And sharp.
In here?
Sharp.
In here?
Dull.
And if I switch to this, does that feel soft or sharp?
Soft.
Good. In here?
Sharp.
And now?
Sharp on the left. Dull on the right.
Very good. Okay. So her ability to sense, you can open your eyes for me, Sandra, her ability to distinguish between two different sensations is intact. Now, I would like to investigate that further for the purposes of today's examination, I will not. So that will conclude the basics of our cranial nerve exam, closing out with cranial nerve 5. Now, I would like you guys to update your notes as you will be tested on this fairly extensively in next week's examination. Okay? All right. Well, let's all thank Sandra for her participation today, and we will see you all next time.